Okay, well, welcome Mosaic members. Thank you for coming today. This is our final webinar in the series. The image of fog over the Golden Gate Bridge represents the effort to reduce your anxiety, stress level, and concern about the unknown. You have a coach dedicated to helping you start your cases and finish them without the worry of not knowing what to do next. We're here to help launch a successful transition from mild to medium orthodontic aligner cases. Let's hold your questions until the end, please. Here are a couple of examples of patients starting or in treatment. The top row of images is pre-treatment, while the bottom row represents the last aligner ready for retainers. The case is about a patient who was treated in her early teens and doesn't like the relapse she's had. She lost her retainer some time ago. Some of the issues would include rotated teeth in the anterior area and a midline discrepancy. Her posterior teeth seem to be doing pretty well. How would you handle this case? Well, first, manage the patient's expectations and let them acknowledge that we can achieve about 80% of the alignment desired. We can't get perfect. Why? Aligners work differently than braces. The second goal is to take records and decide how many aligners this patient may require to reach the intended goal. So how many aligners do you think this patient needs? Take a guess. Okay, so if you look here, we're looking at the number of aligners upper and lower. Roughly that we need is 24, 12 upper and 12 lower. This is a borderline case that you can do in your offices, but I'd be happy to help you make sure that you can do this case in your office. Well, did you guess more or less of what you believe the total number of aligners would be? And look at the estimated treatment time. 16 weeks. So before we start this next patient, I want to remind you that a couple of things. I always show the patient the setups with attachments on them. We don't want to surprise the patient the day of the appointment and they come in and there's attachments they didn't anticipate or expect. This can actually upset a patient. Always show the patient the before and estimated treatment changes. This helps manage your expectations and lets the patient also be involved in the decision process of treatment. So here's another case submitted by a Mosaic member. Notice that before, virtual images show the attachments on the teeth. You really do want to make sure you show them to the patients because they get irritated if they're not shown that. Let's look at this case and notice the rotated cuspids, the crossbite of number 3, and alignment of both lower first molars in the top row. This is a little tougher than it looks. The lower images show the patient after the last aligner. Another tip for you is that people dislike how natural teeth and gums look. Virtual setups bypass this and allows them to look at their teeth or their children's teeth as if it's a rendition of the real thing. So take a look at this case and guess again how many aligners you think it took to straighten the teeth out. So as you can see, the total aligners in this case is about 44. In my practice, I like to keep the total number about here. Why? I can finish this patient in 7.5 months or less. I cheat in my aligner cases by staging treatment. When I have a class 2 or a class 3 correction, a deep bite, a malocclusion with many rotations, an impacted tooth, etc., things like that, stage 1 consists of braces to correct the class 2, 3, deep bites, rotated teeth, etc. Once I've cleared these, the patient is invited to stage 2, depending on their cooperation level, motivation, oral hygiene, overall attitude. We will transfer the case to the aligner stage if everything appears in order. I just started a 30-ish woman in stage 2 yesterday who finished 8 months of stage 1, and she has 19 upper and 12 lowers to finish treatment. Total time for treatment in both stages equals about 15 months. 8 months in stage 1, 7 months in stage 2. She was quoted 30 months of treatment in braces. 8 months sure sounded better to her. Okay, so directly to the topic. Prior to finishing, the patient must be cavity cleared so that you don't need to make another retainer after restoring the subject's teeth. Think of your office and aligners as a smooth flow without stops, like a conveyor belt. When the patient is seated in the chair, the first question always after introductions from my staff is, how do you like your teeth? And we wait for an answer that forks into two pathways. As you can see on the screen, you've got 8 different treatment goals. There's actually a total of 21 and a few gingival rules. But if you follow these first 8, you'll be in great shape with most of your aligner cases. So if the patient's happy and satisfied with their teeth, we have all the paperwork signed to remove the attachments and the teeth are polished. I also recommend a slight occlusal equilibration, then scan for finished casts, take a panographic radiograph, and a series of extra and intraoral photographs. Our next step is to deliver the retainers. Prior to this step, we ask the patient if they'd like to have 2 sets of retainers. In my office, nearly all our patients choose and opt in for 2 sets of retainers. Think of a person with glasses. Hardly any person with glasses has only 1 pair. And aligners get lost. One study from a few years ago said that up to 30% of all retainers are lost in the first 90 days. And today, trying to get another set of aligners might take weeks or even up to a month. We make sure the patient understands how to seat their aligners. They seat them exactly as they do a tray that they've tried before with the aligner seater. That's 10 minutes in the morning and the evening for 4 days. And they'll use them periodically on a weekly basis for up to a year, those seaters. Once the retainers are seated, we're going to seat them in about 3 months. Now, let's suppose they answer number 2, which is, I don't know if I really like them yet. I want some more work done. So how does your staff respond when they ask the patient? And that's the answer they get. The staff member, of course, needs to inform the doctor. And when you go over, you greet the patient and have them show you what they want to change. Look at it, and if it's reasonable, then let them know. Okay, so we need more aligners to try and align that for you. I can't promise it will work, but we can try it. We'll need to order about 5 more aligners per arch. I can discount those aligners for you for X number of dollars per aligner. If the patient's okay with it, they truly want to have that corrected. So you scan the patient, take photographs, and send it off with exact instructions. Once it's set up, have the patient review and accept it. Of course, always document in a chart. Always have your staff discuss bleaching and sealants with the patients before making retainers. It's a benefit to the patient and pretty routine procedure in all dental offices. Always document at your clinical exam before retainers, oral hygiene, range of jaw motion, left, right, protrusive, excursive movements, and centric. Make sure there aren't any glaring contact areas from premature occlusion. Always use the stamp and holding clasp rules. So once we start removing the attachments, we like to use any combination that is used for removing composite. We like using 12 fluted red for gross removal, 30 fluted yellow for the remaining resin, and a 40 fluted one when we want to polish your teeth almost to a high shine. If you have expanded function assistants, get them a dog light that can shine on their teeth. It will show them the areas that are missed. As you can see in the slide that you've got, it's almost like a old black light for old posters in the early 70s. Yeah, dog lights, that's to find dog pee on the carpet. They sell for about $14 on Amazon. You shouldn't be involved with too much of this except the final polish. So just in review, you want to do records, a minimum, when you're finishing a liner case, of diagnostic casts or scans. Look for caries. Make recommendations about procedures a patient's going to need after ortho. Intra and extra oral photos. Check the dental midlines and show patients. That's very important here in California, that you show them the midlines and they know it doesn't line up. Do the panoramic radiograph. That's to document for root resorption, root tipping, or any other issues that you'll see that the pre-panoramic x-ray doesn't show. Have a success story from every patient. Ask them for a success story. Ask them to give you a good review on Google or Sotellus or any of the other systems that are out there. They'll help you with your practice. So finally, I want to give you and show you some of the different types of retainers and appliances that we can use. Patients come in with preconceptions about what the retainer looks like. Their retainer is going to look just like the aligners. It's going to be a little different material, made of either 0.35 or 0.4 millimeter thickness material. Usually 0.25 or 0.3 millimeters used to move teeth. The greater width of the material, the stronger and more durable it will last. I just replaced a set of retainers that I placed 18 years ago. And the patient, they still fit fine, but she just thought it was time for a new set. I strongly urge you to find some sort of marking material to put out that patients can see in your office. It will help them. It will help them ask you questions, help you ask staff for them. It will also give staff easy to remember reasons to do aligners. This is like a must. You have to have some sort of neon sign in the light that says, hey, we're doing some aligners now. Ask us to see if you qualify. I'm working on some animated videos right now. One of them is right above where the teeth actually straighten out. That's after the case is finished. We're working those in the future. If you don't have QR codes, I recommend that you have some made for your office. And I've enjoyed giving this short series for you guys, and I'm ready to open things up for questions. Thank you very much, and best of luck to start cases. You can use my email and contact me directly at drmguess@sbcglobal.net. So let's end the lecture and take up any questions.